Hands of those of you who know what DME stands for. So almost all of us know what that stands for here, but I was with a physician at Petaluma Valley on Sunday, and I told her my dad didn't need any DME, and she said, "What is that?" And I realized that we use that acronym all the time, and I have invited 2 speakers to tell you what DME is and how it's changing in Sonoma County. And I also want them to tell you what the price of some of the DME is so that you can learn to appreciate one of the side projects that we do that so many people in this group are hard at work to make happen, which is our DME recycling closet. So without further ado, I want to introduce Jennifer Volpe. She's one of our own members here. She's with Ron Andrews Medical, and she has brought her trusty, longtime employee assistants. I've had both of them on my radio show, Dan Johnson. Welcome, Jennifer and Dan.
Good morning. I have to tell you I have a little bit of allergy voice this morning, so if you can't hear me, just let me know. I'm Jennifer, and I've been with Ron Andrews Medical for 6 years, and a lot has changed within that 6 years. And I wanted Dan Johnson to introduce himself and tell you a little bit more about the company.
Hello, my name is Dan Johnson. I've been with Ron since I was 17 years old. I'm 48 now, so 30 plus years. Yeah. So Ron's been in business since '75. And he started, as I heard the story out of the back of his car, out of his garage, with a couple pieces of equipment that he purchased, started renting out, and has grown the company since then to where we're at now. We're serving 5 counties? 5 counties, Marin, Sonoma, Napa, San Francisco, San Mateo. We have It's fairly recently been up in Sonoma County. We've had a couple hospice accounts that have gotten us a foothold up here, and we're hoping to make ourselves more known up here. We've got a staff of drivers that are local to the area here. We've got a distribution center here. I live in Santa Rosa myself, as well as 4 of our drivers that service the area. So we're up here in Sonoma County. What else?
Yeah, I think that's it.
We've got the little.
Yeah.
We've got our little PowerPoint here. I think I've pretty much touched on all that. So we are, as it says, we're locally owned, operated. Ron, nobody knows his age. I've asked since I was a kid how old Ron is. Never found out. But he still comes in every day. He comes in every single day at 9 a.m. His son Robert is the vice president. And Ron's handed 1 rein over to Robert and just won't let go of that other rein yet. Sure gets him up in the morning, keeps him young. That's my story.
Thank you. And then he'll be able to answer any medical equipment questions after the presentation. So we were asked today to talk about competitive bidding. How many of you have heard about competitive bidding? I'm actually going to just read from this comment from the Medicare website. Competitive bidding, the Centers of Medicare and Medicaid Services implemented a program that medical equipment companies needed to bid on the right to serve patients within certain competitive bidding areas. Contracted suppliers must submit a bid, and CMS would select a few companies to contract to supply equipment. This program is designed to help Medicare beneficiaries save money and ensure they have access to quality medical equipment and services from suppliers they can trust. For Medicare to help pay for certain medical equipment, the supplies the beneficiaries must obtain from them from a contracted supplier. Jonathan Bloom is the deputy administrator, and he states, the reforms change how we approach waste, fraud, abuse, and improving the accuracy of our payments. These payment changes and investments will strengthen our healthcare system, ensuring quality care for generations to come. So I wanted to read that to you so that you have an idea of what the program was intended to be. Currently, the program was implemented in 109 counties across the country, and there are 9 in California. One that affects us is the San Francisco, Oakland, Fremont area. And you can see there's just a little bit of Sonoma County, which is part of Petaluma, with the zip code of 94952 that's been affected. The equipment, this lists the equipment that is under the umbrella. So you can see oxygen, wheelchairs, hospital beds, and CPAP and BiPAP. So there are two things to this competitive bidding. There were companies that were able to bid on the ability to service the county from all across the country. So there were a few companies that were awarded the contract for all equipment, meaning oxygen, hospital beds, wheelchairs. So you can see the closest one was in Nevada. We have Concord, Riverside, Texas, Florida, and Florida. Most recently, the Life Care Solutions has closed their office in Nevada in Northern California because, from what we understand, the rate of return on investment was too low for their board of directors. And the way I know that is we hired somebody from their staff and talked to the manager there. So the second portion was other companies were allowed to bid on other products. So some companies want hospital beds, some want wheelchairs, some want oxygen. So if you had a patient that couldn't get all the equipment from the companies listed before, you could get one from one company, hospital bed, a wheelchair from another, and oxygen from another company. So you would have 3 different vendors within the home. So how were these people selected? Basically, we also submitted a bid, and we were bidding with larger corporations, companies across the country, and the awards were given to people who basically had the lowest bid. And unfortunately, we were not in that category, so although we've been servicing Marin County for 39 years, we've no longer been able to service Medicare patients in Marin County. So also, 45% is almost half of what providers were receiving, and I'm sure a lot of you have received cuts with your own industry, but I don't know 45%, if it was 45%. So, what does this mean for Sonoma County? I first wanted to actually give you a moment to look at a video of an experience of someone who actually tried to get equipment. And then I can give you more examples of what we've experienced in Marin County. And it's a video. So examples that we've had in Marin County, we've had many patients call us and ask us to rent equipment privately because it's taking 3 to 4 weeks to get equipment, such as hospital beds, wheelchairs. So in Marin County, people are paying privately while they're waiting, when they're just being discharged from the hospital. A more recent experience that we had, we worked with a home care agency in Marin. They called us and asked us to come out that day to help instruct on how to use some oxygen with their patient, because the company had dropped off the oxygen at the front door and told them they couldn't come for another 3 weeks for a face-to-face instruction. We work with another home health agency in Marin where they needed a low air loss mattress, and I had a picture up there of what that is, but it was a Thursday and their patient was being discharged and they needed the low air loss mattress, and the company said they couldn't deliver it. They only delivered Tuesdays and Thursdays, and that the nurse could go to Concord to pick up the equipment. So, let's see. Yeah. So, When will this affect Sonoma County? It is currently actually in progress here. The actual competitive bidding selection process isn't scheduled to start until 2016, but we have had calls from people in Sonoma that have asked us to deliver wheelchairs to their client, and we haven't been able to because they had an address in on record with Medicare in one of the competitive bid areas, so they had to go through that company. We recommended that they change the address to Sonoma County, and then we were able to do that for them. Also, a lot of companies here in Marin County, or excuse me, in Sonoma County, have already decided not to provide medical equipment for Medicare. I don't know if some of you have already experienced this, and this is part in getting prepared for the bid. And we are actually one of the few companies, I'm told, that does take Medicare here in Sonoma County. So another example of how companies are starting to change here in Sonoma County, I met with someone in the town of Sonoma where a company told them they only deliver on Tuesdays and Thursdays. Sound familiar? So the solutions. Of course, the program that Yvonne and everyone has started here, the recycle program, is really going to be beneficial in the future, as you can tell, for equipment like walkers and bedside commodes. The larger pieces, like hospital beds and wheelchairs, some of them are going to need maintenance, and I'll have Dan talk to you a little bit about what's involved with repairing some of those items.
Do you know what the name of HR 1717 is?
I have it on the next slide.
Oh,
Yeah, sorry.
that's cool.
What is it
So, the larger items, we have a process that we go through to basically process all of our equipment in terms of sanitation, checking for proper operation and such. We've got a staff that does that. In the recycling programs, it's probably all on volunteer, I'm assuming. Is that correct? So I would imagine there'd have to be somebody that's willing to be a volunteer to do such things, because some of that equipment, if it's not cared for, can be dangerous to a patient if the wheel locks aren't working. A transfer could end up landing a patient on the floor. So things like that have to be looked at. And I think at some point, before we introduced, they were talking about how much this equipment costs. A hospital bed is well over $2,000, I believe, to purchase. Wheelchairs are $400 to purchase for a standard minimum, low-end chair. So you can see if somebody doesn't have insurance coverage, coming up with that kind of money is going to be tough. So a recycling program would be a great thing for things like that. So, any specific questions from anybody? Yes?
I have a challenge for all of us. I think we should blow up Mike Thompson's office today. I know we're all busy, we've got a lot of things going on, but let's commit as a group and let's get him here and share with them. But I think today's a good day to call his office.
Cool, thank you.
Can we get that email to all of us?
Sure.
Email that we got?
Yes.
So what's in 1717 that's going to be a solution for you?
Okay. Basically, what we've done is we are lobbying with, we belong to associations that are lobbying to get this bill passed, and basically it allows all providers to service the patients in the area. We understand that Medicare needs to save money, and we understand that there needs to be cuts, but this program offers a gradual decrease in the reduction of reimbursements. But the main points are to get the local companies the ability to service the community. Another issue that has there's so many parts to this, but another issue is some of these companies are denying that they cannot provide the equipment, and we are asking in this bill that it be a binding agreement, that they cannot pick and choose when they want a service. So, and then I can, there's the bill, so I can email if anybody wants more information, I can give you that information afterward. There are many supporters of this movement of trying to get the competitive bid to stop, and one well-known is the Reeve Foundation, Christopher Reeves. I didn't bring the whole list, but there are over 40 organizations that are in support of this. If you want more advocacy and more of those videos, the People for Quality Care are really trying to get on a grassroots level the word out and trying to get people who have had experiences to speak up. A lot of them are afraid to speak because they feel that they might lose their Medicare benefit. So that is one issue that we're coming across.
So I'm going to play the devil's advocate here for a minute, and this isn't personal, but I've been running DME for 4 years. There's a tremendous waste, tremendous fraud. I see this Medicare as this is a transition on what's going on, but you know, I have never had a medical equipment company refer to my DME recycling program in Napa County. We compete with the companies, they want the business. So when I announce that there's commodes and wheelchairs, medical equipment companies don't like it. I've approached medical equipment companies in this room, and I've said, here's some flyers for your, and this isn't about Jennifer, I'm just saying, the companies, when they deliver the product, even if the person has died and it has been ordered, they will not take it back, no matter what. People take this stuff to the landfill. I have cases of new Depends, cases of new stuff that the companies have refused to take back. So what I'm saying is, this has been going on for a long time. This is not a new thing, but there is tremendous waste. I have nurses who say, I feel terrible when I throw out 12 cases of brand new enteral nutrition, which costs how much? So what I'm seeing is there is no reuse, recycle going on. And so I'm saying we're in a transition period, and I'm saying there are some good things about this bill, and there's some things that need to be put in, and I think the whole recycling component and the ability to take back is really important. And you know those aluminum walkers that everybody gets? How long do you think they use them? I get them still with the tags attached. Nobody says, let's go recycling first. They all say, we can order it because Medicare pays for it. So I see it, Jennifer. It's just, I mean, I still have people coming, and you know what everybody wants after Medicare pays for it? They want a receipt for their donation. And I go, but you didn't pay for this. Medicare paid for it. So there's a lot of stuff going on with this medical equipment stuff that is just starting to become unearthed. And with the hospital beds, I've had brand new hospital beds delivered where people have had a hospital bed for one day, didn't like it, and went to throw it out. So there's tremendous waste. And I just think as a community, running a recycling program, becoming more aware of what is and isn't out there is really important. But I know that when people call me up, they find out about the DME through a social worker, not through the company that they had initially contacted for services. And those companies have refused to have the information about the recycling program in their facilities. And I just want you to know that this is a business, it's out to make a profit, and when you start giving stuff away, if I can get a hospital bed for free or pay $2,000, what am I going to do? I'm going to come get it for free.
Just a little bit of it, liability on your end to refer someone to.
I just want to address that. I'm sorry to hear that you've had that, but we actually personally do refer people to home care. There's an agency in Marin County that we've been referring a lot of these companies that aren't getting service to home cares in Marin. They're only open on Thursdays.
Recares.
Recare.
Home care, yeah.
Home care recyclers. And that company that I talked about that was in Sonoma, the town of Sonoma, that had deliveries on Tuesdays and Thursdays, I did tell them about the SOA recycling program, and they found that nobody answered the phone and they didn't have time to go to it. So I agree there does need to be more involvement in recycling, but people don't have time to go to that location, so I think there needs to be more built onto it, so I do agree.
We need a truck.
Yeah.
I just wanted to make a comment about what you were saying, Yvonne, is that for us, Medicare, and I'm sure it's like that for all companies, Medicare says once it's in the home, it's considered contaminated, and Medicare doesn't allow it to be returned to the company. So it's not the company necessarily saying these are terrible things and these depend. So that's a Medicare regulation. Breaks our hearts. We're glad to know that there's a place that we can take supplies. They just don't want to allow it.
She asked about the liability of
I know most specifics. I know our liability, I mean, so liability would fall onto the donation center, I would imagine. So that's why I mentioned when we put our equipment through service, you know, the process, that covers our end of the liability. We have trained staff that takes care of the equipment up to manufacturer standards. So we're off the hook on liability. Plus we have, you know, $1 million liability policy. And I don't know if a donation center would have anything.
We have
like
people
that.
sign a form saying that we're not liable.
Yeah. So, but I agree. There's a lot of waste. You know, when I started in this business, one of my jobs as a 17-year-old was to sanitize, clean, and wash APP pads, alternating pressure pads. We would take back commodes and commode buckets. One of my jobs was to empty commode buckets into the toilet, and they were not pretty, and clean them. You know, I built myself a little character in the young days. Suction machine bottles full of fluid would come back to the shop. They would be cleaned, sanitized, and reused. You know, I'm talking in the 80s. There was a lot less waste. Nowadays, all those things I mentioned, we don't even take them back in the vehicle. They stay in the home, and the customer has to get rid of them. You know, walkers used to be rental. Medicare would rent walkers back then. Now they're sale. Medicare would rent a lot of this equipment. Now it's sale. Once it's sold, so we don't take it back. So yeah, there is a lot of waste built by the government, not necessarily by DME companies.
Well, they were lobbied. They were lobbied.
Yeah, I don't know the details.
Yeah, they were lobbied.
any other questions?
Just out of curiosity, these are all Medicare approved expenses. It's just a matter of if you're gonna deal with the Medicare allowable person.
Yes.
So if these people have the correct Medicare supplement, it doesn't matter about the competitive bidding process.
If they
as long as
live,
they're all Medicare approved expenses.
that's our goal, so that any company that
Because
has.
that's what Plan F will do that now. Doesn't matter what anything is, it's what's the total bill and is it approved.
Mhm.
So these people could have the right insurance.
Most of them are Medicare Part B. So-
Well, yeah, it's all Part B,
Mhm.
but they have their Plan F supplement to go with it.
Mhm.
That doesn't care about allowable amounts, it only cares is it approved?
Well,
So
what our
I'm
experience is
wondering-
Medicare will not pay the bill to the company that provides the equipment unless
They're
they're
not
a
supposed to.
contractor, unless they're contracted with the competitive bid.
That's the supplement's responsibility to pay that bill, not Medicare's. And that's what I'm trying to find out, is the approval process different with the competitive bidding?
For supplement, no. They-
No, for Medicare. Doctor writes a prescription.
Mhm.
That's a Medicare approved expense, correct?
Well, if all the documentation is correct, yes.
Yeah, so they don't have to deal with just the competitive bidding people.
If they live in a competitive bid area, they do.
Okay.
For
So-
Medicare to cover it.
For Medicare to cover it.
Okay, so the approved is tied to the competitive bidding.
Yes,
Okay, that's all.
yes. But,
It's not, I think what you're saying is not about paying for it, it's about physically getting it delivered to your house. And who can do that, even if it's approved? Is that
yes.
what you're saying?
If a doctor's office calls us and says, can you please deliver equipment to Mrs. Jones? Here's her RX in Marin County, and she has Medicare insurance, we have to refer them to a Medicare contract bid winner.
What if she calls you?
And if she calls us, same thing. We have to let her know about the competitive bidding process and give her the numbers to call. And she'll have to try to find a provider.
Unless she decides to go private.
And a lot of people are choosing to do that.
Is this competitive bidding limited only to DMEs? In other words, it's not competitive bidding among rehab centers or something for rehab services?
Some of the equipment, the rehab wheelchairs are included.
But we're talking only DMEs.
She means the equipment
Yeah.
that comes from a rehab place, right?
See, I can see Medicare going out and saying, okay, we have this, now we're going to do this for competitive bidding for
Pharmaceuticals.
pharmaceuticals, this, that, and the other.
It's all going to go.
Yes, also mail order diabetic supplies are included. I didn't speak on that because I'm not familiar with that part of it. But this is a list of what's in the current competitive bid.
Are manufacturers getting hit at all on any of this? Because I know the markup on these products are insane. So I know you guys are taking the hit, we're taking the hit, but the manufacturer's taking the hit.
I don't know, I'm not a manufacturer. I haven't heard.
But I mean, are you able to, I mean, that's where the competitive bidding should go, to the manufacturers.
Well, again, there's so many components to this. You did touch on another subject. A lot of companies that have won the bid are purchasing lower quality equipment to provide to them in order to process it.
And unfortunately, there really isn't a whole lot of high-end equipment anymore. You know, the big names, the last ones to go out were to my knowledge, like Invacare was a big made in USA. You know, that was their big pull when everybody else was going to China to do their stuff. All these small low-end companies were coming in with, oh look, compare this bed to Invacare's bed, and it's, you know, you can get it $100 cheaper. Everybody's in China now. That's it. The only thing you can get made in the USA anymore is custom equipment. Some custom bariatrics are still made in Texas, a company that we work with, but most standard stuff is all, there's stuff on the boat right now on its way. You know, we've been back ordered over bed tables for a month from the manufacturer because they're on a boat on their way from China. So there is no high-end equipment anymore. So the manufacturers have probably taken a hit, and that's how they're dealing with it, by getting stuff made cheaper. So that's what we're experiencing.
I know their markups are, I sold DME. I know what the markups on knee braces in particular, they sell for $2,500 and they were made for $700 or $500. So the markup's ridiculous, which people don't realize, but.
No, it's true, and it also affects us because we're delivering it in person.
And they could get a quality product. The margins, they have to lower the margins.
Is there any other question? Any other questions?
Do you guys have a sample letter that we could send to our congressman, and also Jared Huffman is congressman in Sonoma County, as well as Mike Thompson?
Yes, I actually do have a sample letter. I was going to mention that if anybody was interested, I could provide you with that. And then we actually met with Jared Huffman, and we're in the process of trying to get him on board to help us.
Could you tell what his feelings were about it?
He was a new.
He's not old enough to.
Yeah, he's a newbie. He was a newbie.
He's
so,
just a kid.
Yeah, he was a newbie, so I think he was a little more, wanted to consider it a little more. So, anyone else?
Why don't you take some questions after the meeting? So we're going to do our go around. We haven't done it. So thank you so much. Thank you so much. Thank you.